Now we'll talk about medications in babies. Very few medications are okay for a baby to take. Never, ever give fever-reducing medications to a baby who's under a month old. Fevers are serious, and anything that hides a fever can hide a life-threatening condition, and that we can never do. Remember, ibuprofen and acetaminophen can lower fevers, but those can be given after a month old, and you're never allowed to give aspirin to your baby. Now, breastfeeding is always best for baby if possible.
Oh, I know all about that. I'm an expert, you know. Yeah. In fact, now I'm a 38 long.
But sometimes mom or baby are really sick, and it doesn't work to breastfeed. Or if mom is breastfeeding, she's also on an antibiotic or a medication. Now, breast milk by itself is good for baby because it has antibodies that fight infection, and it helps baby's bowels and their IQ and their intelligence. Formula, if you don't need to use it, is important not to, because in many countries, it's illegal to simply buy formula because it's been linked to more asthma, allergies, ear infections, higher incidences of crib death, depression, and obesity. But sometimes you're stuck, and if you have to use it, you have to use it. But mom, if you're breastfeeding and your OB puts you on an antibiotic, make sure you have a baby-friendly OB who gives you one that you can still breastfeed with if at all possible. And pain medicine, if mom is on them, can make babies very sleepy if they're breastfeeding, especially if there's a medication like codeine. So make sure you discuss using pain medication with your OB doctor and your pediatrician if you're breastfeeding.
You know, I see Dr. Whopper on a regular basis. Sometimes I'm nude.
In a world where disclaimers are boring, one man...
Excuse me, Mr. Movie Trailer Voice Guy, please just read the copy in front of you.
Oh, sorry. This video is intended to give you informative, educational information. It is not intended for you to self-treat or diagnose yourself or your family. Because we want you to make good medical decisions when it comes to you and your family's health. Please first talk to your doctor before trying or attempting any of the information that you have seen or heard in this video. Thank you.